Hey guys, good afternoon. Let me know if you can hear me. Hey Andrew, I see you are number one as usual. Hey Nicole, let me know if you guys can hear me. Let me grab some water real quick. I know I'm a couple minutes behind, but I was caught up in something. Hold on one second. Let me know where you guys are watching from. I'll be right back. Let me grab some water. And just somebody confirm in the comments that you can hear me. Okay, I don't see anybody saying they can hear me yet. Wait a minute. Let me see. Can you guys hear me? Let's see. Um, I don't know what's going on. I don't see it's like my screen is not refreshing. Do me a favor and let me know you guys can hear me. Something is going on my end and I cannot Hi ZZ. Hi Jay. Guys, I'm okay, you can hear me. Okay, good. All right, so we're going to go ahead and get started. You guys can put in the comments where you are watching from. I'm going to go ahead and get started because as I always say, if someone is watching the replay, I don't want them to have to listen through all of this. So if you guys happen to have any questions, let me know at the end. Okay, so if you have any questions, just save it for the end and then I will address those as well as any comments in the comment section because, like I said, I don't want it to be too much of a distraction when people are watching a replay. Okay. All right. So let me just go to this on YouTube so I can be in the comment section as well so I can see that because I won't be able to see it while I'm showing the question. So hold on one second. Let me go on the comment section from my phone. All right. Okay, so now I can see the comment section from my phone. All right, guys, so let's go ahead and get started. So let me go ahead to this presentation. Okay, guys, so just a few questions. You guys know the routine. If you've been here with me before, you know the routine. Yes, my old certification videos are helpful. So, guys, remember, because people they keep thinking that the new test is just this whole different test. It is not, ladies and gentlemen. The test is pretty much still the same. There was just some added content. Okay. It is still the same information. So, yes, my old certification videos will still help. Also, if you're taking another test, they do help with those as well. Because remember, in healthcare, certain things are not going to change. Like the vein that you would go do phlebotomy in, that's not going to change, right? The angles that you do your injection is not going to change. Suffix meanings, prefixes, and things, root words, those things do not change. Okay, so it's still the same. It's just that there was some added content. Okay. If you failed the test, you want to make sure, first of all, that you have the study material and you want to double down on studying the areas that you fell short in the first time. Okay. Now, can I get a job if I'm not certified? Yes, you can, but you are more marketable if you are certified. So definitely get certified. Okay. Even if you're working and your job does not require it, get certified because eventually they will require it. You either your job or if you try to go to a new one, they will require it. Some study tips takes us to the next slide. As always, you guys can take a screenshot of this and let me make sure I have my study tips downloaded in the downloaded. Oh, I don't have my study tips there. Okay, guys. So I have let me get that link for you guys really quickly, but I do have a PDF version of this. Let me see. Hold on one second. Let me go to this. Actually, I'll put it in at the end. I want to keep this going. But I do have a handout. It's in a description. It's not in the description of this video, but my last video that I did, and I also put it on my Facebook page, but I do have a PDF with some study tips on there. Also, guys, if you look in the description box, I do have some free downloads there. One of them is like a download for business ideas for medical assistants and a budget worksheet because this month I will be doing more content on medical assistance and money. So saving your money as a medical assistant, budgeting as a medical assistant, paying off your student loans and things like that. So I do have a free budget worksheet that I'm going to go over in a future video. But anyway, screenshot those. Let's get to it. All right, guys. So what is the standard measurement of an EKG? Now, if this is your first time joining live, the way it works here and is that I will give you a couple minutes, few seconds to put the answer in the comment section. Okay, and then I will reveal the correct answer. If you happen to get an answer incorrect, it is okay. This is what we're doing this for. If you see something you've never seen before, perfect, write it down. All of you guys should have a pen and paper anyway when you're going through this, because it's probably going to be something that you have not seen before and need to add to your notes. So make sure you have a pen and paper. If you happen to be driving or doing something while you're listening to this, that's fine. Just go back and watch the replay later, because some of you guys did tell me that you are working out, listening, and driving, listening, and things like that. But when you can, make sure you have a pen and paper, okay? All right, let me see what you guys are putting in the comments. What's the standard measurement of an EKG? Oh, I don't see any answers coming in. Okay, let's see. Maybe you guys are not familiar with this. Let's see. The measurement is 10 millimeters high by 5 millimeters wide. Okay. Now they may try to trick you with this, and they may have it the other way around. It may say, 5 millimeters high and then 10 millimeters wide. So make sure that you know this. Okay. So the measurement for the EKG is on the paper is 10 millimeters high and 5 millimeters in width. Okay. All right. So let's go to this next question. Oops, I went back. All right, guys. So a pediatric patient weighs 17 kilograms. How much is that in pounds? Pediatric patient weighs 17 kilograms. How much is that in pounds? Somebody put the formula in the comment section for me in the chat. What's the formula to figure out this answer, converting kilograms to pounds? What is that formula? Congratulations, Esselina. Oh, Esselina was on my study session the other day. Congratulations. Yay, Lena. So guys, Lena was on, I did a group study section, and I'm going to have another one coming up. I'll let you guys know the date at the end. It's going to be on April 20th, but I'll go over that at the end. But she was on my group study session where we are live on Zoom. Everybody has their camera on. We all can see each other, and we're going through, you guys can submit questions and lessons you want to go over, and we go over those lessons. And then, I just give you guys some extra information, some foundational information. So congratulations. All right, so I see you guys got the answer there. I went backwards again, sorry. Yep, 37.4 pounds. The formula is to multiply by 2.2, right? Going from kilograms to pounds, you are multiplying by 2.2, and vice versa is going to be dividing by 2.2, okay? So again, add that to your notes. Any of you guys watching here didn't know that, make sure you add that to your notes. All right, what are vesicles? What is that? What is a vesicle? Now, you guys know I do these open-ended questions, because if you know what these are, then it doesn't matter what question you get asked. I want you guys to get into the habit of not going through the test information with multiple choice questions. I want you to to get into the habit of doing this way, because when you know it, you know it. Okay. What are vesicles? Vesicles, those are small fluid filled blisters. Okay. Now, a common cause is the herpes virus, right? So vesicles are small fluid filled blisters. The common cause is the herpes virus. Okay. So if you didn't know what vesicles were, make sure you add that to your notes. So that way, if you happen to get a question on a test that asks something about vesicles, and there's something, and you see this definition, that is a vesicle, right? Or they may throw some other things, and then you're like, no, vesicles, those are small fluid filled blisters, right? All right, next question. What are papules? What are papules? What are papules? So those are solid elevations that are less than 0.5 centimeters. So that's going to be like your eczema, okay? Like your allergic eczema. Okay, so again, make sure you write this. Those are solid elevations. It's not fluid filled like the vesicles are. So if you see that question and it says fluid filled and you see, papules as an answer, then you know that that's not the answer, because that's more of a solid elevation, and it's like your eczema. Okay, let's go. Next question. True or false? You should instruct your patient to take a laxative before providing a stool sample. Is that true or false? Hey, Laura. Okay. I'm looking forward to hearing Laura. That she was another one that was on my group session this past one. Congratulations, Hamza. True or false? You should instruct your patient to take a laxative before providing a stool sample. Okay, I see the answers coming in. Let's see. If you said false, that is correct. Using a laxative can give false results. You do not want to they do not need a laxative to you know, for a stool sample. Now, and if they're getting like a colonoscopy or something like that done, some type of rectal examination or test, then yeah, then they would need to they would need to take a laxative or colon cleanse. There is some special medication that a patient has to take when they're having something like that done. Before a stool sample, no. All right, true or false? Vitamin D is used to promote bone health. Is that true or false? Is vitamin D used to promote bone health? Is vitamin D good for our bones? Is that true or false? Vitamin D. Okay, so I see the answers coming in now. Yep, that is true. Vitamin D is good for our bone health. That is true. All right, guys. Which stage of grief might a patient be in if they refuse to accept their diagnosis? Which stage of grief is that the patient might be in if they refuse to accept their diagnosis? Make sure you guys know those stages of grief. The patient is refusing to accept their diagnosis. Okay, see those answers coming in? Denial. Yes. So let's talk about this for a second. I want to make sure you guys know those 5 stages. So I always say use the acronym DABDA. And let me just put that in the chat really quickly. DABDA, right? That's the acronym you use, DABDA. So you got denial, which is, refusal of accepting it, or maybe, they just can't believe it. Like, this cannot be possible. This cannot be true. And then next you have anger. Anger, of course, anger is self-explanatory. The patient is angry. They could be angry at themselves. They could be angry at the provider, feeling like the provider let this happen, or, and then you have bargaining. Bargaining is when they try to basically almost like they're trying to make a deal with themselves to okay, so if all I need to do is cut back on certain things, and then I can get rid of this. Like, all I have to do is or even maybe bargaining with God, like praying to God, like, God, if you just get me out of this, this last time. So that's bargaining. um D is depression. The second D is depression. That's self-explanatory as well. And then A is acceptance. That's the final stage. Okay, so the way they'll throw those in there, they'll name some scenarios, and then you have to know, based on the meanings of the acronym, which stage that the patient is in. All right, which of the following may require IV contrast? Now, and I did throw in one multiple choice question on this one, because for a reason. I did this. I think this is the only multiple choice question that I have on this one, but I did that for a reason. Which of the following may require IV contrast? Let's see. Yeah, CT scan. So I went on ahead and made this one multiple choice just so I can let you guys know that for X-rays and ultrasounds, mammograms, you don't need contrast. Okay. All right, guys. So a deficiency in which vitamin can cause pernicious anemia and a state of confusion? And deficiency in which vitamin can cause pernicious anemia and also can cause a state of confusion? Okay, I see the answers coming in. Oh no, that was from the last one. You guys know? Oh, are you saying vitamin D, Sandra, or are you? I didn't know if you were saying the answer to the last one. I don't really see any answers coming in for this one. It's vitamin B12. Okay, make sure you add that to your notes. So vitamin B12. Okay, so deficiency in vitamin B12 can cause pernicious anemia and also a state of confusion. Okay, so I have another vitamin question here too. A deficiency in which vitamin can cause heart failure and nervous disorders? A deficiency in this vitamin can cause heart failure, can result in heart failure or nervous disorders. Let's see if any coming in. Oops, I didn't mean to do that. Okay, so this is going to be B1. So I want you guys to make a note of that. So we said B12, right? Because you can see any one of these. I'm going to give you the other B vitamins too. So you got B12. We said that can cause or result in pernicious anemia and a state of confusion. Deficiency in B1 can result in heart failure and nervous disorders. Okay, I'm going to give you B6. So a deficiency in vitamin B6 that can result in cracks around the mouth, a rash, as well as depression. I'll say that one more time. Add this to your notes. Vitamin B6 a deficiency in vitamin B6 can result in cracks around the mouth, a rash, and also depression. Okay. And then B3. B3, a deficiency in B3 can result in digestive issues. Okay. So B12, I mentioned B12, B6, B1, and B3. Okay, so make sure you add those to your notes. So again, if you happen to see either of these mentioned on the test, okay. All right, which tube is used for hematology tests? Which tube is used for hematology tests? Oh, Sandra said late entry. What are we discussing? We're going through the study material, exam material. All right. So that's going to be lavender, EDTA, lavender. Okay. All righty. Next question. Which tube is used for serum tests? And so, guys, as you guys are going through this, make sure you are also not just making notes of what I'm showing you guys, but also make notes of things like, okay, I need to make sure I go, look at the 5 stages of grief and make sure I know that. Okay, I need to make sure I know, what type of tests for each tube. Right now that you see me talking about tubes, then that means you need to make a note. Okay, these are things that I need to know, because everything that I show you guys on these study sessions are things that you need to know. I don't waste my time or your time going over things that's not going to be on the test. Okay, now of course we know every test is different, so we don't know how much of what you're going to have on your test, but everything that I go over is foundational information that you need. So whenever you see me go over something, I'm hoping that you are making notes. Okay, let me make sure I know which test for each tube. Let me make sure I know the additives. Let me make sure I know the order of draw, right? This is how you take notes when you go through these videos. You got to make sure you know these things. Okay. So this one is going to be red. I see you guys did put red. All right. True or false? Patients may immediately leave after the results of an allergy test are confirmed. So the patient had an allergy test. The results are confirmed. Should they leave right away? And guys, I see your comments in the comment section. I'm just going to go, I'm going to go back after this, after we go through all of this. So I will go back and look at your questions and things like that. So don't think I'm ignoring you. I just don't want it to be too much of a distraction for anybody that's watching a replay. Okay, yep. So that's false. Patients should wait at least 30 minutes. Okay. Yep. Anaphylactic shock is no joke. All right. So what percent of bleach and water should we use to disinfect an area? What percent? Okay, see the answers coming in. Yep, 10%. You guys will see that. Yep. Yep. All right. Okay, what are some examples of DME, durable medical equipment? Now they may just say DME on there. They may write it out, but DME stands for durable medical equipment. Give me what are some examples? I mean, you guys could just put one, or you can name multiple, but let me see that you guys know what durable medical equipment is. When we refer to durable medical equipment, what are we referring to? Okay, I see them coming in. And guys, if this video is helping you, do me a favor and like the video. That helps with getting the video out. Somebody asked me, "How can I pay you, Miss K?" You can't pay me anything. Don't pay me, but just like and share my videos. That's how you can pay me. All right, let's see. Walkers, crutches, wheelchairs. Yeah, so these are things that help the patient get around, right? Walkers, crutches, and wheelchairs are examples. All right, true or false? It is within the scope of an MA, medical assistant, right, to give directions to a patient about preparation for a diagnostic test. Is that within our scope to give directions to a patient about preparation for a diagnostic test? Yes, so somebody said oxygen. Yeah, the oxygen equipment falls under that as well. Yep. Um, let me go back to this. All right, let's see. Yep. So that is true. We can give directions to a patient about preparation, right? We can give those directions to a patient because we're getting those orders from the provider. So of course we cannot order the tests. We cannot offer alternative treatments, right? We cannot advise the patient. So let's say you're going over the instructions. Yes, it can. Let's say you're going over the instructions and your patient says, well, what about if this, if they start asking questions, you have to refer them back to the provider because it happens. You go in there, you're just going in there to reinforce the teaching or, let them know how to prepare. Then they start having questions. You just have to let them know, unless the provider specifically gives you instructions. Okay, tell the patient this, tell the patient that. Then those questions will have to be directed back to the provider. And then you're going to have some patients that's going to say, well, what would you do? And of course, you guys know that you cannot offer that advice. I'm sorry, I can't say what I would do. You have to, if you have any questions or concerns, I can bring the provider back in, but I can't. That's not something that I'm able to discuss with you, even if it's tempting, because it might be something that you are against, right? And it takes us back to ethics, right? Law and ethics. We have to put our personal feelings to the side. Okay, so even if you don't agree. All right, what type of procedures may require prior authorization? Give me some examples of procedures that may require prior authorization. And what is prior authorization? What is prior authorization? Someone says, Natasha says we're helping set up the equipment most times, right? So yeah, it's possible. So I mean, like if like wheelchairs, like we may have that in the offices. We may have to go down and bring patients up, or we don't necessarily. I mean, I guess it kind of depends on where you work, but it's not like you necessarily have those things in the office. unless you're working somewhere, maybe like orthopedics where you have crutches there, and have to, give those out to patient. I've something like that, but you don't, that's not necessarily something you are. It kind of depends on where you, I hope that makes sense. It kind of depends on where you work, but it's not like something where, it's not a situation where every office you in, you're going to have to pass out wheelchairs or crutches or, canes and walkers and things like that. But if you're in orthopedics, definitely you will, you guys will have some crutches there, because patients come in, they find out they have like a sprain or something like that, and then they have to take crutches home, and maybe the doctor's doing a procedure that will require them to be on crutches. So yes. All right. Okay. I see these. Yep. I see these. Yep. Someone says prior authorization is pre-approval from insurance company. Yes. So some of those include surgical procedures, hospital visits, and radiology exams. So you don't need prior auth for basic things that we do in the office, like EKGs and like, urine tests and things like that. You need them for like surgical procedures, like an endoscopy maybe, or colonoscopy, any type of surgeries, of course. Maybe a CT scan or MRI may even require prior authorization depending on the patient's insurance. Okay. And that means that you are calling the patient's insurance and requesting authorizations in advance. Okay. Let me go to this next one. I'm going to let you guys read that when I have a call coming through. Hello. Okay. All right, guys. Sorry about that. I had a call coming through, but I do see you guys are putting the answer in. So yes, I did see you guys saying let the provider know. So yeah, so you want to let the provider know, okay? You're not going to unhook the patient. You're not going to tell the patient, "Oh man, you have an arrhythmia. Oh man, you have AFib. Man, you have A flutter. Oh, you have tachycardia." We're not going to tell the patient that. We're just going to simply say, hold on one moment. I just need to show this to the provider before I unhook you. Simply leave it at that, okay? Most of the time, depending on how your office is set up, you may have to show the provider anyway. I know when I was in family practice and internal medicine and things like that, EKGs weren't something we did every day. It was just, if a patient had chest pain. So in that case, we had to show it to the provider before we unhook the patient. So in that case, you got to do that anyway. But if you're somewhere like cardiology, you probably won't have to do that each time, like show the provider. But if you see an abnormal result, like the patient has an arrhythmia, like something is going on abnormal, you need to take that to the provider and show it to them. Okay. Don't unhook the patient. Don't alarm the patient. And we're definitely not going to tell the patient that everything is okay. Right. So the patients, they may get alarmed, but just 1 second, I'll be right back. I just have to show the provider. Okay. And we're not going to give any, assurance like everything is okay. And we're not going to do any of that. Even if everything is okay, we cannot give assurance. That's the provider's job. Okay. All right. How should you communicate with a group of diverse patients? So you have a group of diverse patients. They're from all over, like different backgrounds, different ethnic group, different races. Like, how do you communicate with a group of diverse patients? Yeah, X-rays don't always need pre-op. Yep, X-rays on X-rays and it depends on where, but a lot of times X-rays people could just literally walk in for an X-ray. I mean, they need an order, of course, but I mean, like they a lot of times I know that's how most of the hospitals are in my area. Like they don't need an appointment; they literally can just walk in with their order. All right, how should you communicate with these people, with the diverse? Sorry, guys, I'm stuttering. Diverse group of people. You want to have a calm tone of voice and also maintain eye contact. So, and also remain respectful. Yes. So, I know that this is a text test question that I literally saw on the test. I was there was some students taking the test at my school, and I happened to go in there, and I was walking around. I was monitoring the test, and I happened to be behind a student, and I saw this very this exact question actually on the test. That's why I included it here, where they ask about the like, do you use generational terms? No, you don't. Do you use slang? Some of it was kind of self-explanatory. Do you use slang? Do you yell? Things like that. But I definitely saw this exact question on the actual test. Yep, keep your voice calm, maintain. Oh, the other another one was avoid eye contact. Now, I will say this. Now, this is off the record, nothing to do with the certification. I will say this, that I do know that in some cultures, eye contact can be a sign of intimidation. I do know that, but that is we aren't even addressing that on this test. So even if you know of a culture in which you should avoid eye contact, don't even let your mind go there when it comes to when you're taking your test, because these tests are strictly by the book. They're not going to go into anything like that. Okay. All right. True or false? Venipuncture requires informed consent. Does venipuncture require informed consent? True or false? Venipuncture requires informed consent. All right, I see the answers coming in. Yep, it's false. So verbal consent. So the patient can verbally consent, right? Or implied consent. So verbal consent is self-explanatory. Implied consent is what? It is consent based on the patient's actions. So maybe they don't verbally say, yeah, sure, but they give you their arm. Okay. Informed consent, guys, that is when the patient actually has to sign the consent form acknowledging that they were explained the risk, the benefits of the procedure. They're signing that they understand that they can choose not to have the test. They're consenting that they understand that there are alternatives, and that the provider explain that to them. Okay. Also requires a witness, right? That is for like your surgical procedures and things like that. But you don't need that for venipuncture. All right. What is a cryoprobe used for? Cryoprobe. Cryo. What is the term cryo? What does cryo mean? What is the prefix for cryo? What does that mean? Cryo. I'm sorry, I said what is the prefix for cryo? I meant what does the prefix cryo mean? Okay, I see answers coming in. Okay, let's see. All right, it uses cold temperatures to remove cancers of the skin and also warts. Yep, they use extremely cold temperatures to freeze off cancers of the skin and also warts. All right, guys, what does the suffix tripsy mean? What is tripsy? What is the suffix tripsy? What does that mean? Tripsy. You guys got to know that terminology. So, guys, make sure you know every single body part. right? Terminology for every single body part, right? Make sure you know your suffixes, right? For your procedures like tripsy, ectomy, otomy, ostomy, all of those, right? Your common prefixes and things like that. Okay. All right. Crushing. Yes, crushing. Um, what does the suffix plasty mean? Oh, someone says they got their book here. Okay. Used for colposcopy. Yes. So if a person has cervical cancer, yes, they can use a cryoprobe. And yes, hypothesis is liquid nitrogen, a cryo. So it is not a cryoprobe, but it is used, um, is dipped into um, um, like a swab or something, maybe dipped into liquid nitrogen. Yes. All right, let me go back to this. Surgical repair, plasty surgical repair. I see you guys put that on there. Yep. All right, what does the suffix synthesis mean? So synthesis, if you see something ending in synthesis, what is going on? While you guys are answering that, let me try to get this link for my study tips. So you guys go ahead and put that in there for synthesis, and let me just grab my link for the study. It's just a PDF version of the study guide. Copy the link. I got the link here, guys. Let me go to this next one. Let go to the answer. Yeah, so puncture to remove fluid. Yep, you guys got it right. I see you. You guys are questioning it. Puncture? Is it puncture? Is that correct? Yes, Nataja and Quila. I hope I'm saying your name right. Yes, you guys are correct. Puncture to remove fluid. Okay. All right. So what does the prefix A mean? A. And let me put this link in here. So if anybody wants those tips that I gave in like a PDF form, link to study tips, I'm putting that here. Control V. I just put that in a comment section, and let me also add this to the description as well. Let me go to the description of this video. Hold on, guys. I'll let you take a moment to answer that while I go and put this in the description box. Let me go to the next one and then do that. Yep, without. Yep, you guys. Yep. You're welcome, Natasha, for the link. So guys, I did put the link for my study tips in there, and when you guys download these freebies that I give you, it does add you to my email list. I'm not going to spam you guys. I started an email list because of the fact of all of these outages with social media and stuff, and they talking about they might ban TikTok and all of that. I don't know if it's true, but I'm like, let me start getting my people on the email list. So if something ever happens with any of this social media stuff, I can still be in contact with you guys. I'm not going to send a bunch of emails, but I would like to be able to connect with you guys outside of social media just in case. All right. What is a durable power of attorney? What is a durable power of attorney? A and does mean without. Yeah, you put two A's. I'm guessing you meant and. Yes, and also means without. Free downloads, free guide, free study tips. Let me add that. Hold on, guys. To the description. Study tips. 10 study tips. Hold on 1 second, guys. My daughter is calling me. Hold on. Let me mute myself for 1 second. I'll give you guys a chance to type those in. All right, guys. Sorry about that. So let's see. I see the answers coming in. All right. Yep. So it's a person authorized to make medical decisions for a patient if the patient is unable to make decisions for themselves. Okay. So I see you guys put that in there. Yep. Speak on your behalf, legally authorized. Yep. You guys are correct. Somebody said family member. It could be a family member, it could be a friend, whoever you want to, whoever the patient wants to appoint. All right. What method of blood collection should you use for an infant? Okay, let's see. Yep, capillary puncture. So yeah, so you're gonna use a heel up until their one, and then after that you can use their fingers. So yeah, actually yeah, up until their one you can use their heel, 12 months, and then you can use their fingers. Yep. All right, guys. So when diagnosis coding, all right, you're using the ICD-10 manual, which is an ICD-10 CM. Where should you look first? What part of the manual should you look first? Okay, let's see. Yep, you want to start on the alphabetic index, okay? Because that's where you're going to find the diseases, conditions, okay? And then you're going to cross-reference it in a tabular list, okay? So you're going to go to the alphabetic index and you're going to look for it. So, let's just say you go and you find the code for chest pain, right? You're going to go look for pain, and then because you don't when you're looking for an ICD-10 code, you're not looking for the body part, okay? So when you're using that ICD-10 manual, you're going to go look in the alphabetic index and you're going to find pain. Once you find pain, then you start looking for the type of pain, okay? So, and that's actually, I think that's a test question where it says you can use a body part to look when you're looking for the ICD-10 code, and that is incorrect. Now, when you're doing a CPT code and procedure coding, you can use a body part. But when you're specifically looking for ICD-10 code, you want to find the condition first, so like pain, and then you'll go look for what type of pain. Okay, chest pain, right? The code that you get once you find the code beside what you're looking for, Then you want to cross-reference in a tabular list, because when you go to the tabular list, it's by number. So let me look up chest pain. I forgot the ICD-10 for chest pain. Hold on, ICD-10. Let me look this up real quick. ICD-10 chest pain. Let's see. So R072, right? So let's say you're going in the ICD-10 code, you see, and this is for precordial pain. Unspecified is R079. So let's say you look in the alphabetic list, you got R079, right? So that's the alphabetic list. Then you want to go to the tabular list, and what you want to look for is that code that you found, R079, because now you want to make sure when you look up R079 in the tabular list, it should say chest pain unspecified. Okay, so that's how you cross-reference. You go to the alphabetic list, and that is a question. So guys, make a note of that. It's because it'll say like, where do you cross-reference? You cross-reference in the tabular list. Okay, and what you're doing is just making sure that the code is correct. Okay. All right. What's the normal range for hematocrit levels? I say hematocrit. What is the normal range for hematocrit levels? Okay. How Paul, you said, can you show an example? Yeah, so that example was chest pain. Chest pain, you find the code with anything, not just chest pain, with any code. You find the code, and then you just go back to the tabular list, and which is volume 1, and then you want to go in there and make sure that the diagnosis beside that code says what you were looking for. That's how you cross-reference. The normal range for hematocrit levels. Guys, make sure you know these blood work ranges, okay? And then I do have a video on my channel that goes over the ranges and all of that, right? So it is there. So make sure you know these ranges. I don't see any answers coming in, so I'm guessing this is something you guys need to know. All right, so male patients, 42 to 52%. For females, it's 36 to 45. So you guys got to make sure for both, okay? So approximately is correct. It's 42 to 52%. Yes, you need to know. Yep. You got to know that. You got to know all of the ranges. I have a video on my channel. It says it's called and you can make a note of it to look at later, but it's called like what is it, blood work ranges. It either says blood work ranges, or like it says like ranges you need to know for the test or something like that. But you'll see it was kind of recent. It's been in recent months. But I show you all the blood work ranges that you need: sodium, potassium, hematocrit and hemoglobin, what else, glucose. All of those things that you need to know, those ranges for the test, they are all in that video. Oh, it's called lab values. Okay, thank you, Michelle. What's the normal range for hemoglobin? What is the normal range for hemoglobin? So we got hematocrit. What's the normal range for hemoglobin? I'm going to just go ahead and show you guys because I'm guessing you probably don't know. So that's going to be 15 to 17 for males, and then 12 to 16 for females. So hemoglobin. Okay, Michelle. Yep, you were right on it. So you guys will notice that hematocrit and hemoglobin, they differ for male and females. I believe everything else is just general normal limits and expected ranges, and I think hematocrit and hemoglobin are the only ones that differ with male and female patients. Now the numbers are slightly different. So I do see somebody put 14 to 18. Now it's not a big difference, but I know that from the 2.0 version to the 3.0, it's differed slightly, but it was like by one number. So maybe it was 14 to 18, which is still, it's depending on where you look, what site you look at, what book, things like this, like numbers can be off slightly. That's just kind of the same way when you look up respiration, right? Some books you look at may say 12 to 20, some may say 14 to 20. So it's still correct, but it just kind of may vary just a little by one number. Okay. All right, guys. So this was it. I just want to remind you guys that on April 20th, I'm going to do another study session only because people are asking for it. Like it wasn't something that I had planned on doing, but you guys can go to bookwithmissk.com if you want to study, if you want to join the study session. But guys, just make sure you like this video and subscribe if you haven't already. Share it if you guys are not already in my Facebook group. Make sure you join. And again, bookwithmissk.com. You guys can go there if you want to join. You'll see virtual group study session for April 20th. You can do that, or you can do a one-on-one session. You could do that any day that I have available. Let me know if you guys have any questions. I'm gonna go through this comment section and see now because let's see. I didn't want to do anything during too much during the video. You're welcome, Quila. I hope I'm saying your name right. Is it Quila? Let's see. Let me go back to the beginning. Let me know if you guys have any questions. Oh dang, I didn't realize it was so much. Okay. So congratulations to everybody who recently passed their test. I know there was a few people in the beginning saying that they have recently passed their test. Someone says I have CCMA certification, but I'm facing difficulties in finding a job because of experience. What is your suggestions? Thank you for asking that question, Daisy. I think it's Daisy. Listen, ladies and gentlemen, if you are listening right now and having a hard time finding a job, please listen to me when I say this. And I've said it a few times before. I posted about it. I have a couple of videos on this very thing. Please listen to me if this is you, or maybe it's not you yet, but you're about to finish school. Listen to me. Sometimes it's not going to come so easily. What you're going to have to do, you got to pick a day that you're going to go around to some offices to visit in person. You're going to have to do that. It works. So I told you guys I've done that multiple times. You're going to have to just find a day, put on some slacks and a button up top, dress professionally, print out some copies of your resume, and you're going to go around to some private offices and you're going to ask for the hiring manager. Hi, my name is Tanya. I'm a medical assistant. I was wondering if you guys were hiring. Oh, you are? Can I leave my resume? They either going to say yes or they're going to say no. If they say no, you go to the next one. That part, that way of looking for a job is tedious. I understand, but it works. So I need you guys to do that. So if you happen to be one of those people on here today and you're listening and you're having trouble, that is going to work. It may take you to go around to a few offices. And this is why I recommend go into a building that has multiple offices on each floor. Okay. Don't just go to find a doctor's office here, find it, then you got to go across town to the next one across the street. No, go to buildings that have multiple offices in them. Okay. When you go to like a hospital, a lot of times you'll notice they have a building attached, a physician's office building with a bunch of offices. Those are ideal. I'm telling you, it works. Even if you got to drop your resume off to 100 places, because looking for a job can be a full-time job. But until you have done that, you have not done everything you can do. Once you tell me, oh, I went on Indeed, I've contacted recruiters, I've gone to multiple offices, I've over multiple days, and I've gone to different buildings, and it's still, then I could say, oh wow, this is a job crisis. It's a job crisis with medical assistants. Until then, this is what I need you to do, because that works. If nothing else works, that works. Trust me. Okay, so I'm just going through looking at these comments here, just making sure I'm not missing anything. Congratulations to Marie. Sandra's about to take her administrative test. So Sandra, I hope that administrative questions were helpful to you. Your insurance has to approve the procedure that they will cover. Yeah, so it's a pre-approval. And even then, Natasha, they'll still say it's not a guarantee, which is weird because you would think, oh, I'm getting pre-approval. You mean to tell me you still won't cover? They have to say that. But most of the time when they give that pre-approval, as long as what you got pre-approval and pre-authorization for. So if you say the CPT code was chest pain, and then, the ICD-10 code was chest pain, and they're getting we wouldn't have to do that for EKG anyway. Let's just say maybe they getting a heart catheterization and their diagnosis is coronary artery disease, and this is all of the things the information that you gave them. And then when you go bill them, you give them something else, then that's different. But for the most part, yes, they're going to cover it, but they still will tell you it's not a guarantee until it's done. Okay, I'm just looking through here. Yep. All right, guys. And good luck to everybody that's about to take their test too. Let's see. Vastus lateralis muscle region. So vastus lateralis, that is a site for injection. So we were referring to venipuncture, drawing blood, right? Vena is vein, puncture is that's something, guys know what puncture is, but we're drawing blood with venipuncture. And I think actually, no, we weren't talking about venipuncture now. We were talking about what were we talking about? Blood collection. Sorry, we were just not necessarily just venipuncture, but blood collection in general. And that is from the capillary puncture for a baby. And then vastus lateralis, that is a site for an intramuscular injection, not blood collection. All right. Oh, pronounced Kayla. Got you. Okay, I'm sorry, Kayla. That's a pretty name. I love the way it's spelled. It looks like Quila, but I like that. That's pretty. Okay. Yeah, Zizi, it was quick. She said, wow, that was quick. I know, Zizi, sometimes we're on here for like more than an hour, but when we go through it this way, open-ended, it's quicker. And then I was kind of going through it because my daughter, she's about to get off work, and that was her calling me. So I did have to kind of rush through this. Okay, you're taking your test in June. Okay, so you got some time, Sandra. You getting a head start. Oh, Zizi says I share videos with my classmates. Thank you, Zizi. I'm hoping they helping. Okay, Michelle, you taking your test March 30th. Good luck to you. What do you think about going to cardiology practice straight out of school? I think it would be nice. I work in a cardiology practice, PRN. I used to work there full time, but just know with cardiology, you're gonna be doing EKGs all day. You may be doing some finger sticks if they do the INR test in there, and you may not even may, you will be putting on Holter monitors and event monitors. And then depending on what kind of office, you may have to do stress tests. Now depends, because if you're in a private office, you have a little bit more autonomy and you may do stress tests. But if you're working like a big company, I don't know what the big companies are in your area, but if you're working like here in my area, there's like Kaiser, Anova, companies like that, like they have it to where like the nurses will do the stress test. They only want MAs to do what MAs do, and then the nurses do that. So it kind of depends. But yeah, go for it. I love cardiology, especially if you like doing EKGs. Do you have to know codes for admin exams? So you don't have to know specific codes. No. So it won't say like, what is the code for chest pain? Like, no. If you go take billing and coding, then yes, you get more in detail. But with the administrative exam, it's more so about knowing what each code does, like CPT codes. And make sure you guys make a note of that if you didn't know. But CPT codes are procedural codes, right? And the ICD-10 codes are diagnosis codes. So CPT tells the insurance what the provider did. ICD-10 codes tells the insurance company why the provider did it. And you got to know what a modifier does. And you got to know, procedures for billing the patient's insurance, right? And some accounting questions. And then, of course, you still got to know terminology and some anatomy. But no, you don't have to go. They don't go into details with the codes. But if you want to go to billing and coding, then yeah, you get deep into it. Kayla says you're fine. I get it. So you must be used to people saying mispronouncing your name. You're welcome, Jazz. She says I'm starting MA program soon. I like to watch your videos. Wow, Jazz, you just get ready to start and you already watching. She getting a head start. I hope it doesn't overwhelm you, Jazz. If you happen to get overwhelmed with anything, then stop watching, because I don't want you to get overwhelmed and start worrying about things that you don't need until the end. So I'm glad you're here. I'm glad you're getting a head start, but don't overwhelm yourself, because but I'm glad you're here. Okay, guys, and I'm going to put this I'm going to just put my link in the comments as well. Make sure you like this video, ladies and gentlemen, if this video was helpful to you. Andrew, are you still watching? Andrew is always number one, and he likes to make it known that he's number one, but I don't know if he's still here. Are you still here, Andrew, or you like to just be number one and leave? So bookwithmissk.com is just if you want to book a one-on-one session with me, or if you want to do, and those one-on-one sessions is not just for the test, ladies and gentlemen, it's for anything. Yes. Wild Rice said, is that the is that the cops? Yes, they are not here for me. I am on a busy street. So I live in DC, and I'm in the city. I don't know if you guys where you guys are located, but I'm in DC. I'm in the city, and the street that I live on is very busy. So whenever I'm on here, you are bound to hear anything because it's you. So you can imagine how things are at night when I'm trying to sleep. I hear all kinds of things because I'm on a very busy street. I'm surprised you heard that. But so as I was saying that the sessions are not just for the test, it's for any type of help you need. Resume, cover letter, tutoring on any subject or anything. So just want to let you guys know that the next session is going to be April 20th at 11. And then I think that's it. Make sure you guys check out the downloads that I have, the 10 business ideas, the study tips, as well as what else did I put on there? Oh, budget. If you guys didn't, make sure you check out that last video that I did talking about ways to use your tax refund, guys. I want you guys to know the correct way of using your, credit cards, and if you have them, and maintaining good credit and getting good credit, fixing your credit. We're going to be talking about all of that. Budgeting as a medical assistant, because we're going to talk about more than just the test. We want to be ready for real life as well. Okay, guys. I don't see any other questions. I'm going to wait a couple more seconds, and if not, I'm going to go ahead and go. And I hope you guys enjoy your Friday and your weekend. I am just going to wait just a couple more seconds just to see, and if not, I am going to let you guys go. Let's see. All right, guys. I don't see anything. You all have a great weekend. Be blessed.